This is the radius and ulna of the ox. The radius, this is the radius and this is the ulna. The radius and ulna, these two bones, they remain fused and they form a single bone that is known as os antebrachii. This radius and ulna, it anatomical position that it is vertically placed. So vertically placed होता है between the humerus and above and the carpellus below. So above it articulates with the condyles of the humerus and below with the carpels. So first we will discuss about this is the larger among the two bones, that is the radius. The radius, it has a shaft that presents 4 surfaces. 4 surface होते हैं. That first one, that is, this is the anterior surface. This is the posterior surface of the radius. Then this is the lateral surface and this one is the medial surface. So first is anterior surface. The anterior surface, it is convex and smooth and it is occupied by the extensor muscles of carpus and digits. So ये smooth होता है, convex होता है, और यहाँ पे extensor muscles of carpus and digits present होते हैं. And on the same surface below, 3 grooves होते हैं. There are 3 grooves. These are the different grooves. This is the lateral groove, this is the central groove, and this is the medial. So which allow the passage of the tendons of these extensor muscles. So here you can, on this one can also see these are the grooves. This is the lateral groove, this is central, and this is the medial groove. So same grooves are here. So the lateral groove, it allows the passage of tendons of medial and common digital extensor. Central groove, it is widest, and from here extensor carpi radialis, the tendon of extensor carpi radialis passes from here, and the medial groove, it accommodates the tendon of the extensor carpi obliquus. So this was about the anterior surface. Now come to the posterior surface. The posterior, this is the posterior surface. It is concave and this surface, it remains fused with the anterior surface of the ulna throughout its length, except the interossseous spaces. So this is the proximal interossseous space and this is the distal interossseous space, or radio-ulnar arches, that is proximal radio-ulnar arch and distal radio-ulnar arch. So this was about the posterior surface. Now coming to this lateral surface. The lateral surface, this is smooth and rounded, and this lateral surface forms a vascular groove. This is a vascular groove with the lateral surface of the ulna. This vascular groove, it accommodates interosseous artery or common interosseous artery that passes from this vascular groove. So this vascular groove is formed by the lateral surface of the radius and the lateral surface of ulna. Now coming to the last one, this is the medial surface. The medial surface, if you see here, that it is concave above and below it becomes smooth and rounded. So it is concave above and smooth and rounded above. So these were the different surfaces of the shaft of the radius. So this whole bone, this is the radius, and we have discussed about it in different surfaces. Now coming to the proximal extremity. The proximal extremity, if you see, it presents 2 articular surfaces. The articular surfaces, they articulate with the condyles of the humerus and they form elbow joint. So this is the medial one, which is larger. This is lateral one, which is smaller. And the cranial rim of the articular surface, it forms a lip-like projection, that is known as coronite process. This is the coronite process. And anteromedially on the proximal extremity, there is a rough elevation present that is known as radial tuberosity for the insertion of biceps brachii muscle. And posteriorly on the proximal extremity, there are two facets, concave particular facets that articulate with the corresponding facets present on the ulna. So this was about the proximal extremity, and here on either side there are tubercles present for the attachment of the ligaments of the elbow joint. This is the tubercles. So now coming to it is distal extremity. The distal extremity, it presents three articular facets which are oblique in direction. This is medial, this is middle, and this one is lateral. So the medial articular facet, it articulates with the radial carpal, the middle articulates with the intermediate, and the lateral, which is saddle shaped, this articulates with the ulnar carpal, and it is lateral boundary, it is formed by the ulna. So you can see the lateral articular facet, it is completed by the ulna. So this was about the proximal and the distal extremity of the radius. Now coming to the next bone that is longer among the two bones, this is the ulna. The ulna also presents. The ulna, it is attached or fused at the anterior lateral aspect. So this is posterior lateral aspect of the radius. So the ulna, it is fused at the posterior lateral aspect of the radius. So the ulna, it also presents the shaft. This is the proximal extremity. This is the proximal extremity, and this is the distal extremity of the ulna. Now coming first to the shaft. तो shaft होता है, इसमें तीन surfaces होते हैं. एक आगे से the anterior surface which remains fused with the posterior surface of the radius. Then this is the lateral surface, and this is the medial surface. These two surfaces, they are narrow, and the lateral surface, it is flat, while as medial surface is concave. ठीक है. So तीन surface होते हैं, anterior surface, lateral surface, and this is the medial surface. There are three borders. This is a posterior border, this is concave, and here the border that is present, that is known as lateral border, and here this is the medial border. So lateral and the medial border, they remain fused with the radius. So the shaft of the ulna presents तीन surfaces होते हैं और तीन borders होते हैं. Now coming to the proximal extremity. The proximal extremity of the ulna, it presents a semilunar notch. This is the semilunar notch and an olecranon process. This is the olecranon process. Now first, the olecranon process, it has two surfaces. This is the lateral surface. This is medial surface. The lateral surface, this is convex, and the medial surface, this is concave. There are two borders present. This is the anterior border, which is thin, and it projects downwards in a lip-like projection, beak-like projection, that is known as Anconius process. So the anterior border, it forms a beak-like projection. It's called Anconius process बोलते हैं. And this is the posterior border, which is concave, and this extends up to the distal end of the ulna. So olecranon process में there are two surfaces, lateral surface, medial surface, two borders, anterior border, posterior border, this is a big life projection that is known as Anconeus process, and which overhangs this semilunar notch. So Anconeus process जो होती है वो overhang करते हैं, this is the semilunar notch. The proximal end of the olecranon process, it forms the summit. This is called a summit. This is the summit. This is known as summit for the insertion of three muscles, that is triceps brachii, tensor fascia antebrachii, and Anconeus muscle. So three muscles are inserted on this summit. Now coming to the distal extremity of the ulna. The distal extremity, it remains fused with the radius and it projects downward and forms styloid process of the ulna. This is the styloid process of the ulna. So this was all about the radius and the ulna. Thank you.